Welcome back to the Deep Dive. Today, we're teaming up with the Association of Workers' Compensation Boards of Canada to explore something pretty crucial. The Canadian Mental Health Association's State of Mental Health in Canada 2024 report. You can think of this as a national mental health checkup. And, well, let's just say the results are pretty alarming.
Yeah, it's definitely a bit of a wake-up call, I think. It's not just about looking at the numbers, though. It's about whether Canada is actually upholding its human rights obligations when it comes to mental health.
Right. And this report uses a whopping 24 indicators to paint a picture of this landscape of mental health and addictions and substance use. So that's a lot to cover. But from what I've seen so far, it seems like we're falling short in some pretty big ways.
Yeah, unfortunately, that's true. The report highlights three main areas where Canada really needs to improve. The first is funding for mental health services. Then there's the need for more consistency in how those services are delivered across the country. And finally, the report found some pretty shocking gaps in the data we're even collecting about the problem.
Okay, so let's unpack that first issue. Funding. The report found that provinces and territories only spend an average of 6.3% of their healthcare budgets on mental health. That seems really low.
It is. It's actually less than half of what experts recommend, which is closer to 13%. And to make matters worse, our national mental health strategy hasn't been updated since 2012. So we're basically operating on a plan that's over a decade old.
Wow. So we're drastically underfunding mental health care, and we're relying on this outdated strategy. That sounds like a recipe for disaster.
It definitely is. And it's especially concerning considering the fact that the demand for these mental health services has been increasing so much in recent years.
Where is all this money going? Or rather, where is it not going? Does the report actually break down spending province by province?
It does, and that's where we run into that second major issue, inconsistency. The amount of money each province actually spends on mental health and how they spend it is really different across the board. Like, for example, British Columbia doesn't even clearly report how much they allocate to mental health and addictions and substance use.
So we don't even know if they're investing enough to meet the needs of their population. That seems like a pretty big transparency problem.
It is. It really highlights the need for more accountability across the board in how these provinces are managing and reporting their mental health spending. On the other hand, Alberta is very transparent about their spending, but they only dedicate 5.5% of their healthcare budget to mental health, which is even lower than the national average.
Okay, so transparency is important, but it doesn't guarantee adequate funding. What are those policy differences that you mentioned earlier?
Well, one example is harm reduction. British Columbia is considered a leader in harm reduction, offering a wide range of services like safe consumption sites and needle exchange programs. But Alberta has been much more hesitant to embrace those kinds of initiatives.
So you're saying that just depending on where you live in Canada, your access to these literally life-saving services could be completely different. That's fundamentally unfair.
It really is. It highlights the need for a more unified approach to harm reduction across Canada. We can't have a patchwork system where people's access to essential care depends on their postal code.
It makes you wonder what kind of impact this is having on people across the country. Does the report talk about the human cost of these failures at all?
It does. The report talks about the really difficult challenges faced by Canadians living in the territories. They actually experience much higher rates of self-harm and suicide than the rest of the country.
That's heartbreaking. What are some of the factors that are contributing to that?
Well, the territories face a bunch of different challenges. There's historical trauma and systemic racism and poverty. And on top of all that, they have really limited access to mental health services. They just don't have the resources or the infrastructure to properly support their populations. And this actually brings us to that third major issue that the report flagged, data gaps.
So on top of all of these other problems, we don't even have a complete picture of what's happening in the territories.
Not really. And this lack of data is actually a problem across the board. The report found that we're missing crucial information on tons of important issues. Like, for example, we don't have reliable data on the availability of mental health promotion programs or the wait times for services. And the information that we do have is often inconsistent or incomplete, especially for the most vulnerable populations.
So we're essentially trying to solve this massive problem without having all the information.
Yeah.
That sounds like trying to navigate a maze in the dark.
It is. It's really concerning.
Yeah.
We can't possibly develop effective solutions if we don't even understand the full extent of the problem or how it's impacting different communities across the country.
Okay, so to recap, we've got Inadequate funding, inconsistent services, and these huge gaps in our data. This all paints a pretty grim picture.
It does. But there is some good news. The report actually provides a lot of recommendations for improvement. It suggests some really tangible ways that we can strengthen Canada's mental health system.
And I'm assuming those are worth exploring. Okay, so we'll dive into those solutions in just a bit. But for now, let's dig a bit deeper into the specific challenges that each province is facing. Where should we start with such a diverse landscape?
Well, we've already talked about British Columbia and their unique approach to harm reduction and their lack of transparency. So why don't we start there and see what else is happening on the Pacific Coast?
Sounds good. Let's head west.
So British Columbia, they actually have a pretty comprehensive mental health strategy, on paper, but the fact that they're not transparent about their spending, well, it makes it hard to tell if it's actually working.
It's kind of like having a blueprint for a house, but no way to know if they're using the right materials or even if the foundation is solid.
Exactly. We really need to be able to track where the money is going and if it's making a difference in people's lives.
Accountability is so crucial, especially with something as important as, mental health care.
For sure. Now, moving over to Alberta, their challenge is kind of the opposite. While BC is struggling with transparency, Alberta doesn't even have a comprehensive mental health strategy.
So they haven't even taken that first step of, figuring out a plan to tackle the issue.
Yeah, pretty much. But they have been talking about this recovery-oriented model of care, even without a formal strategy.
That sounds promising. So what exactly does a recovery-oriented approach look like?
Well, basically, it means focusing on empowering people to, reach their full potential and live fulfilling lives, even with mental health challenges. The focus is on building resilience and supporting people to manage their condition rather than just treating the symptoms.
So it's more holistic, more focused on the person.
Yeah, exactly. But some people argue that Alberta's version of this model focuses a little too much on abstinence-based treatment for substance use.
Meaning, instead of harm reduction strategies like safe consumption sites, they're more focused on getting people to completely stop using substances.
Right. And that's a pretty big concern considering how serious the opioid crisis is in Alberta. They have the second highest rate of opioid-related deaths in all of Canada. So, it's really important to consider all evidence-based approaches, right?
It's a really tough balance.
Yeah.
Harm reduction versus abstinence. There are no easy answers.
You're absolutely right. It requires a really nuanced and compassionate approach. Okay, let's shift gears to Saskatchewan. What's happening there?
Sure.
Saskatchewan is interesting. On the one hand, they did just launch a new action plan for mental health and addictions, which is a good sign.
So they're at least acknowledging the need for a plan, right?
Yes. But the question is, will they put their money where their mouth is? The report flagged concerns about funding for these services in Saskatchewan.
Not surprising, unfortunately. It seems like a lot of provinces have good intentions but don't follow through with the funding.
That's true. And Saskatchewan's also been a bit hesitant on harm reduction. Similar to Alberta, they haven't really been quick to implement things like safe consumption sites, even though there's proof they work.
It really highlights the need for a bigger shift in how we think about harm reduction in this country. It's not about, saying drug use is okay. It's about saving lives.
Right. Okay, now on to Manitoba. They have some unique challenges, especially around child poverty.
They have the highest rate in Canada, don't they?
They do, and that's a huge problem because we know that poverty is a major risk factor for mental health struggles. Growing up in poverty can have a lasting impact on, a child's development and well-being.
It's a really tough cycle to break. Poverty leads to stress, instability, lack of opportunity. It all takes a toll on mental health.
Yeah, and Manitoba also has one of the lowest rates of spending on mental health, which just makes things worse.
High need, low investment.
Yeah.
Not a good combination.
Not at all. And to top it off, they've also been slow to implement harm reduction policies, just like Alberta and Saskatchewan.
It's frustrating to see this resistance to evidence-based approaches. It feels like ideology is winning out over science when it comes to drug policy.
It can feel that way for sure. Okay, how about we look at Ontario now? It's Canada's biggest province, so what's standing out there?
If I remember right, they have a decent mental health strategy, but their housing crisis is a major issue.
You're right. The report mentioned Ontario's high rates of core housing need, meaning lots of people are in homes that are, inadequate or too expensive.
And we know that not having secure, affordable housing is terrible for mental health. It's so stressful.
Absolutely. It's hard to build a life without that basic foundation.
And they've got those long wait times for services too, right?
Yes, that's another big challenge. Even though Ontario spends a decent amount on mental health overall, people are still waiting a long time to get the help they need.
So even when there is money, the system itself can be a barrier.
Exactly. It's a complicated issue, and there's no quick fix. Okay, let's head east to Quebec. What's their mental health situation like?
Okay.
Quebec is really interesting. They actually have the highest levels of self-rated mental health in the whole country.
Wow, that's surprising. What's going on there?
It's hard to say for sure, but some people think it's because of their strong social safety net. Things like subsidized childcare and more affordable housing might be making a difference.
It makes sense. If you're not constantly stressed about basic needs, you have more space to focus on your mental well-being.
Exactly. And Quebec has been ahead of the curve on universal mental health care. They have a pilot program that offers free psychotherapy, which is huge in terms of accessibility.
So they're investing in both, like the social safety net and direct access to care. That's awesome.
It is. But it's important to remember they have challenges too. Like, even though therapy is free, the wait times can be long and there's a shortage of family doctors.
It seems like no province is perfect. Even with good self-rated mental health, there's always room for improvement.
That's true. We should always be looking for ways to grow and adapt. Okay, let's keep heading east and check out the Atlantic provinces. How about New Brunswick?
Let's do it.
One thing that stands out about New Brunswick is their strong sense of community. People there tend to report higher levels of social support and, less stigma around mental health.
So it's easier to talk about mental health and ask for help because people feel supported by their community.
Exactly. And that's really important. Feeling supported can make a huge difference for your mental well-being.
It's like having a safety net, knowing you're not alone in your struggles.
For sure. New Brunswick is also working on making mental health services easier to access with things like same-day and rapid access care.
So they're focused on getting people help quickly when they need it most.
Right. They understand that, if someone is in crisis, getting help fast can make a big difference.
Meeting people where they're at and providing support in the moment.
Yes. Now, they do still have some challenges, of course. The opioid crisis is hitting them hard, and there's a shortage of psychiatrists, which is a problem we see in a lot of places.
It's a pattern, isn't it? These issues are popping up everywhere.
They are. It shows just how complex and interconnected these challenges are. Okay, what about Nova Scotia?
What's happening there?
Nova Scotia is on the verge of something really exciting. They're getting ready to launch a universal mental health care program.
Whoa, seriously? So that means free access to therapy for everyone.
That's the goal. It would be a huge step forward and could be a model for other provinces to follow.
It's a really bold move. They're basically saying that mental health care is a right, not a privilege.
Exactly. But it's a big undertaking, and there will be logistical and financial hurdles, of course. Their spending on mental health is below the national average right now, so it'll be interesting to see how they fund this.
Having a vision is great, but you need a plan to make it work.
Very true. And Nova Scotia also needs to catch up on harm reduction. They've been falling behind in that area.
Okay, so we've got one more province to cover. Prince Edward Island. We talked about them before because their spending on mental health is higher than average, right?
Right. PEI seems pretty committed to funding mental health, but they're still dealing with some of those same challenges we keep seeing. Not enough psychiatrists and a shortage of beds for inpatient care.
So even with more money, access to specialized care is still limited.
Yeah, it shows that we need to focus on building up the mental health care workforce, not just throwing money at the problem. We need more professionals, especially in rural areas.
It's a reminder that there's no single solution. We need to address funding, policies, data collection, and the workforce, and look at the social factors that affect mental health.
Exactly. It's about building a system that supports everyone, no matter where they live or what challenges they're facing.
It's been really eye-opening to look at all the different approaches across Canada. We've seen some good things happening, but also a lot of areas where we need to improve.
Definitely. This report shows us that mental health is connected to so many things. Social issues, economic issues, even politics.
And it shows how urgently we need to make a change. If we want Canada to be a truly healthy and compassionate country, we have to prioritize mental health and invest in a system that actually works for everyone.
I agree. This report is a wake-up call for everyone. The government, communities, individuals, we need to work together to make things better.
Great point. Okay, so the big question now is, what are the solutions? This report has some recommendations, so let's dig into those and see what a path forward could look like. So we've talked a lot about the problems facing mental health care in Canada, but the good news is This CMHA report has some ideas for how to make things better.
It's a real roadmap for change. How to make the system more fair, easier to access, and actually effective.
I like the sound of that. So where do we even start?
The report focuses on three main things: more funding, consistent policies across the country, and fixing those gaps in the data we were talking about before.
Let's start with the money. We know mental health care is seriously underfunded. What does the report say needs to happen?
It says all levels of government need to step up and increase funding. And not just a one-time thing. This has to be a long-term commitment.
So basically, we need to treat mental health as important as any other part of our healthcare system.
Exactly. We can't just wait for people to be in crisis before we do anything. We need to put money into prevention, early intervention, and make sure there's support for people throughout their lives.
And it sounds like just throwing money at the problem isn't enough. It has to be spent in the right way.
Absolutely. The report really pushes for evidence-based solutions. We need to invest in things that actually work.
Okay, so more money, smarter spending. Got it. Now, how do we fix those inconsistencies in policies across the country? How do we make sure everyone has access to the same level of care?
This is where a pan-Canadian mental health strategy comes in. Basically, a national plan that sets the standards for care and makes sure services are consistent no matter where you live.
So no more of this postcode lottery where your care depends on your address.
Nope. This strategy would cover everything: prevention, promotion, crisis support, long-term care, the whole spectrum.
And I imagine it would have to tackle those social factors we talked about too, right? Like poverty and housing.
Definitely. The report is very clear about how those things, poverty, housing, discrimination, all affect mental health.
So it's not just about mental health services themselves. It's about building a fairer society where everyone has a chance to thrive.
You got it. We have to invest in those social programs, affordable housing, education, all of it, because mental health is everyone's responsibility.
Okay, so we've got funding and policy covered. What about the data gaps?
Yeah.
How do we even know what's really going on with mental health across the country?
We need way better data collection, more information on how common mental health issues are, what treatments work best, how accessible services are, everything.
And we need to be able to see how things are changing over time, track the trends, and spot new problems before they become huge.
Exactly. And it's not enough to just collect the numbers. We need to analyze them too, break them down by age, gender, race, income, location. See how different groups are being affected.
So we can figure out where the inequalities are and address them.
Right. This data should be driving our policies, helping us see what works, and holding the government accountable.
It all sounds great, but is this even realistic? Can we really make all these changes happen?
Changing the whole mental health system is a big job, no doubt. But it has to happen, and this report gives us the plan to do it. It's up to all of us to demand better for Canadians.
So what can our listeners do? How can they get involved?
Number one, get informed. Read this report, find out what's happening in your own community, talk to people who have experienced mental health challenges firsthand.
Right, because the more you know, the more you can do.
Exactly. And don't be afraid to speak up. Talk to your elected officials, tell them what you think, and demand better mental health care.
Let's make sure our politicians know we care about this issue.
You can also support the organizations that are already doing this work. Volunteer your time, donate money, spread the word. Any little bit makes a difference.
And most importantly, let's all be more compassionate. Let's stop the stigma around mental health so people feel safe to talk about their struggles and get help.
I love that. This report is a bit of a reality check, but it also gives us hope. If we work together, we can make Canada a place where everyone has a chance to live a mentally healthy life.
That's a great place to end it, I think. Thanks for joining us on this deep dive. And to all our listeners out there, if you or someone you know is struggling, please reach out for help. You're not alone. Thanks for listening.